Welcome. My name is Katie Henches, and I'm the Interim Director of Collaborative Programs and Initiatives at the Child Neurology Foundation. Today's talk is part of our ongoing series on emerging issues that children and families with neurologic conditions are experiencing as a result of COVID-19. These sessions bring together caregivers and healthcare professionals to have a candid conversation and provide their expert advice to the child neurology community. Today, we are discussing being intentional with your grief during COVID-19 with Blyth Lord and Nancy Frumer Styron. Welcome. Thanks for joining me today. We're so excited to hear your perspective.
Thank you. So I'm Blyth Lord. I'm the founder and executive director of Courageous Parents Network, which is a nonprofit based in Massachusetts, national nonprofit. Our mission is to empower, support, and orient parents caring for children living with serious illness and rare disease, as well as the pediatric providers who care for these families. Many of the families in the network have children living with serious neurological conditions. I am also the mother of 3 daughters, and my second daughter, Cameron, died in 2001 at the age of 2 from infantile Tay-Sachs.
And good morning. My name is Dr. Nancy Frumer Styron. I'm a pediatric psychologist by training, and I spent 25 years in the field of pediatric oncology at the Dana-Farber Cancer Institute here in Boston. And I am currently the clinical director at the Children's Room, which is a bereavement center in Arlington, Massachusetts. I also work with Blyth as part of Courageous Parents Network, considering issues and talking about issues that arise for families with a child with a life-limiting illness. And those include things like decision-making, siblings, anticipatory grief, and bereavement.
Yes, Nancy and I have done a lot of meaningful work and had fun because of its purpose in framing the issues for Courageous Parents Network. So it's fun to be here with you, Nancy. And thank you, Katie, for this invitation. Working as I do with families living with children with serious illness, I've seen firsthand how this period of COVID has brought up so many experiences of grief and loss for people, and for certainly the families, and then beyond, really, everyone. And some of the issues are relevant to death, and some are not. And so we talk about being very intentional about naming this, acknowledging this as a time of grieving, and thinking about how what's coming up for us can inform how we move forward and what we do in the future.
So just thinking about, we're talking about grief and we're talking about loss, and there are all different kinds of loss. So we want to name that there is clearly sort of most overtly death loss when somebody has died. But there are also all kinds of secondary losses that arise from that. And there are all kinds of other losses, particularly that we're seeing now. And just to name some of them, whether we're talking about loss of employment, we're talking about divorce, we're talking about the role that the person who died had in the family and all the adjustments now and the new roles that people have to take on, a loss in history as we thought we knew it. I think it's important to acknowledge that as a nation, we are grieving the death of particular people. Personally, we are grieving as a nation for how many Black lives have been lost. We are grieving the way we knew things to be. Now, sometimes that's a good thing. We'll talk in a moment about sort of what grief is. And particularly during COVID, we've also lost all the rituals that we knew that we were able to use as part of grief. Sitting Shiva, a funeral, going to a wake, being with a person as they were dying. All of those are losses that we're experiencing right now as well.
I want to jump in there, Nancy, because of a good friend of mine, his father died 2 weeks ago, not unexpectedly and not in COVID. And there was a moment there where they thought they couldn't have Shiva. And the family was very sad and upset. And then they thought about sort of being intentional about it. What would it mean to not have one, and how could they try to use technology to have one because they felt like the aftermath of not having had any sort of shiva or service would be too painful. And so they did find a way, and it really made a tremendous difference. So I think of that as sort of an example of what could have happened and how it didn't.
Right. No, I appreciate that. My sister-in-law actually died of COVID a few weeks ago, and we were with her online in a way we never would have been, actually, because she's far away. Mm-hmm. So it is important to sort of begin to appreciate what it means to be grieving in the moment, not postponing this because it's sort of, oh, later when it's all better, things will be changed, but we don't know that they'll be better. So part of what we wanted, we hoped, I think, Blyth, right, to talk about today was the importance of being intentional in the moment also with whatever grief is coming up.
Yeah. So Nancy, on that note, can you define for us what grief is? I will say for myself, prior to my daughter's diagnosis, I thought grief was just something that happened after somebody you love died. And as soon as we found out that she had infantile Tay-Sachs, which was 18 months before she died, I started grieving heavily. In fact, that was even hard. In many ways, that was the hardest moment, was getting the diagnosis. And so that's when my understanding of what grief means just started to expand significantly. Can you elaborate, please?
Yeah, no, I appreciate that, because I think often, when we ask people, their first response is, well, it's just being sad, or it's sad after somebody died. And grief is so many things, actually. It's really a response to a loss, whatever that loss is, and I named a number of them. And so people think of it as sadness, but it's all the feelings that go with a loss. For some, it's relief. For some, it's memory. For some, it's anger, frustration, confusion. And sometimes it's appreciation of a change. And sometimes, believe it or not, it's actually joy. Someone I've recently worked with said, every year we get together on the day my mother and sister died, and we share memories and we talk about things, and it's sad, and it's all the other pieces of what it means to remember. I recently ran a group for parents who are grieving, and we asked that question, and their responses were really varied. Grief is love that you can't have anymore. Grief is the pain of missing the person. Grief is work and a process, somebody said. Grief is regret over the things that you didn't do. And then there's, of course, anticipatory grief, which is also a little bit of what you're talking about from the time of diagnosis, Blyth, all the things that are not going to happen. And sometimes it's long before somebody has died. It's in anticipation of sometimes the actual death, but also anticipation of all the things you thought. So knowing sometimes that somebody's going to die, or, for many children who have a brain tumor, for example, and already have changes in their functioning, it's the grief of the things that they're not able to do that you had planned for what it might look like.
Yeah. So I think I also want to talk, and you mentioned critically that we as a country are in this period of grief and loss, certainly because of COVID, and now with Black Lives Matter, there's such a significant shift in how we are seen and being asked to see the lives of others and our country. And that awakening can also bring with it a sense of loss. Like with new awareness can come a re-understanding of what it is, and at which point you comes a sense of loss for how you had perceived it before, and also sadness about others that you hadn't thought necessarily about before, and also sadness for your country in this case, and then sort of anxiety perhaps about how to move forward. And that, I think, is where the intentionality really comes in for yourself when you are grieving a loved ones, and then for your country, if that's what it means. It comes all these different scales at which grief and intentionality operate.
And I would just add to that, this is not new, right? Whether people have been dying or we have been mistreating historically over time, this is not new. And grief is not linear. This is not something where we have it and then we move through it and we're done. Yeah. This is something that is an ongoing situation. And as more people die or the awareness increases, there's a lot of pain that comes with actually being able to see. So knowing that it comes up again, it comes up sort of in its most simplest form around anniversaries and birthdays and holidays. But it also comes, and we're seeing this now as a nation, when we have to really recognize what life we thought it was, or we pretended it was, or perhaps it was for some people, but it isn't that way anymore. And the grief arises again.
Yeah. So you and I went with Katie when we were planning this conversation. It was important to us to not just talk about grief and name it, but also think about how to empower each of us as individuals to move forward with what is coming up for us and what facets of grief there are. And we called it being intentional. And the different ways that looks is, how to make meaning in a positive way. And I can say for myself that the meaning that came out of my daughter's illness and death evolved over time. What it meant to me shortly after her diagnosis, and then shortly after her death, and then 13 years later when I started Courageous Parents Network. It was like a snowball. It just collected more and more and more meaning. But can we pause there for a minute, Nancy? Because you very importantly talked about there's a difference between making meaning and making sense. Can you clarify that? Because I think it's an important distinction.
Yeah, I think, and I was going to come back to what you were just talking about what it means to be intentional. And to be aware or to know is not necessarily the same thing as to do. Maya Angelou talks about, when we know better, we do better. Mm-hmm. And that we're always learning over time. So I'm wondering, when you think about what it means now to be intentional with what you've learned, what would you say in terms of, because meaning making also happens over time, sort of what we understand at the beginning, oh, now I get it. And then we have more life experiences and we make different choices, and what it means to make choices. So can you say a little bit more about sort of what you've learned about what it means to be intentional, and now how do you be intentional again?
I know. So what I've learned, and so much of this was retrospective, right? Is initially being intentional for my husband and me was just recognizing that we were grieving and going out and getting help. So the first step in our intentionality was, this feels terrible. We are scared. We need help. So we went and got help. And the help, which we got through a therapist, this phenomenal therapist, really actually, she worked with us to see, and she had us sit with our grief, which was a form of intentionality, and talk about what was coming up for us. And then through that, see our respective strengths and how we had in us what we needed to be good parents and to get through and to parent our other daughter who was healthy, and to take care of each other and to let other people in to help us, and ultimately to get through her death. And then she helped us frame how we would think about her legacy and how we would ritualize her. And so then the intentionality was about rituals around her life. And then the intentionality evolved into something bigger for me, wanting to give back to a broader community. So then that happened, but this happened over time. I mean, certainly I would never have imagined starting a nonprofit 15 years after she died upon diagnosis. And I think it's really important to acknowledge that intentionality takes different shape over time as how we process evolves. And then I will say the intentionality, knowing that I had within me, recognizing that I had sort of been in a state of grief before, then when COVID happened, recognizing that state and saying, okay, what meaning will I make out of this difficult time? And I see that a lot in the families that Courageous Parents Network works with, families of serious illness, say, oh, this is a familiar space for us. We know how to do this. We can do this. Welcome to our world, actually. That's what a lot of them say.
Yes, no, I really appreciate that. And just highlighting something that I was hearing throughout what you were just saying has to do with one of the things about not being isolated. You know, that it's sort of grief, I'll do it by myself, or I'll put it away until tomorrow. I think with COVID, people will say, well, we can't do anything now, so we'll do it later. And I think what you and I are both really encouraging and inviting people to do is to recognize that isolation is not necessarily your friend. Being able to own things and feel them now, it doesn't mean you're not going to feel them later. Trust me, you will. But whatever you are able to sort of do now and do with others, whether it's with a therapist, whether it's with just other family members, whether it's picking up the phone and reaching out, whether people are even in a book club and talking about what's happening in the world, that people are not isolated, and that changes people's perceptions and understanding of how they're coping, how others are coping, and you take that learning. I've also had many parents say, you know, I've already done this, either because my child died, my spouse died, because I've been living with illness for so long. My child's had a brain tumor for the past 5 years. I actually sort of know how to do this. So I appreciate the welcome to my world, but being able to be intentional about the skills you've learned without feeling the pressure of everybody, oh, well, you already know how to do this. It's like, no, I have to do it now again, intentionally. And that then changes the choices we make in the future. It also makes a difference in terms of going forward intentionally and making choices. What did I learn from that grief at that time? What do I need to grieve now? Because it keeps coming up. And do I do it differently? What did I learn? How does that change? Whatever I learned changes me, and now I do it a little bit differently.
I think, you know, as we are at a threshold in this moment in time, you know, June 2020, where there's been such a shift brought on by COVID, and in this country, Black Lives Matter, where things just look very, very, very different. And we are emerging into a new space. I think it's helpful, if you have had a personal experience of grief, to remember the growth that came out of it, or the transformation, I should say, and to rely on that as evidence that change for the better, or change can be for the better. Not in a way that justifies the bad. Of course, none of it justifies the bad, but we can't change what's happened. What matters is what we do with it, right? Going forward. And hopefully that helps with the coming back into this new space.
Right. You know, we were talking earlier about sort of emergence. We had been calling it re-entry. There's a lot of discussion about re-entry, and in different parts of the country, some people are already entering, whatever that means, and some people are doing that cautiously, and that there will be grief there too as we emerge. Because one of the things that we've learned, as hard as this has been, what it might mean to have been with your child in a way you wouldn't have been before. What does it mean not to have had to commute to work, from the smallest to the biggest, sort of even more meaningful, that we will be grieving some of those losses as well. And that owning that as hard as it was, there were some things that were positive. So as we emerge, appreciating what those things were. When you recognize that you've lost something, there's sometimes a deeper appreciation for what it was. And so being able to think about, okay, I can't do that anymore, but what did it mean that I had it? And if it was that important, how do I now bring that into my future? That people may make very different choices about how they live their lives, how they spend time with people.
Yeah.
And I think the other thing about emerging is that there may have been rituals, there may have been things that people actually were not able to do, spend time with people. There may have been deaths, that there were many, many deaths that have occurred, and those rituals were not able to be performed. What it means not to hide and say, you know what, I'm not going to bother. It already happened. To actually be able to say, I have to step into this again. I didn't get to do it. And it's really important to recognize for the person who died or for the situation that I need to keep moving with that grief.
Yeah. And I personally can attest to the fact, the value of that. In the year after my daughter died, my husband, bless him, thank him, wanted to have rituals once a week to recognize her life. And I really resisted that because I was like, we touched it with her memorial service. Like we've done this. I don't want to do it again every week, but it always felt better after. And I'm so glad that he made us come back to it. I'm so grateful that he did.
So I appreciate that. I think it's helpful even in the now, when, people are sort of mixed. On the one hand, it's like, you know what, we'll do it later, so they don't have to tap into it now. And then I worry that when later comes, it's sort of like, oh, you know what, it's already in the past. What does it mean to actually take on some rituals now? It might mean pulling out pictures. It might mean if the person's birthday happens during this time, and we don't know how long this time is going to be, what does it mean to sit down and talk about the person as a family? Make cake that the person's favorite food was. To be able just to spend 5 minutes a week actually acknowledging either that the person died, or if there are all these other losses, that this is a change. What does it mean to spend time? Because those rituals will carry you through into the future. They become a part of who you are as a way to remember.
Yeah. Can I say one more thing? We've talked about sort of the scope of grief, like there's the personal, local, national. I do think it's important, especially given the Child Neurology Foundation, that the families affected by seriously ill children or children living with neurological conditions can only handle so much. We can only pay attention and be intentional about so much. So even as you and I have named all the different scales at which there are things that we are being called to pay attention to, there's only so much an individual can pay attention to. And there's no guilt or shame in not being able to pay attention to all of it. And I by example, my daughter died right before 9/11 happened, and I barely paid attention to all the names of the people who had died because I just couldn't hold it. I was too busy carrying my own grief, and I could not look at all the other people's grief and all the other loss.
No, I think it's really important. One, that there not be any guilt. Two, that the importance of self-care, that in order to manage whatever you're managing, whether you're taking care of your child currently, I work with a family who have basically been in the hospital this entire time, and they know what COVID is. They know what Black Lives Matter is as a nation and as a world issue. We have world issues going on. But in terms of what your priority and where your focus needs to be, it is okay also to be intentional about that.
Yeah.
It's not being dismissive of the other things, but to be really intentional about what your priorities are. As a parent or as a sibling, it's really okay to say, you know what, for this moment, this is where I need to be, and this is what I need to do.
Yeah, this is all I can do. This is all I can do.
And that there's enough grief in that.
Yes.
Without having to attend to everything else. The time will come when you're interested, willing, able to do that. that's okay. But for now, to be really intentional with your grief, where you need to be with your grief.
Right on.
So I think, Katie, we may be at our time. We were trying to be careful about time. And we know if people have questions, there will be an opportunity, I think, once this is shown. Katie, maybe you can share more about that.
Absolutely. Yes, thank you both so much for joining and sharing your expertise with the child neurology community. For resources and more original content from the Child Neurology Foundation to help you navigate care for children and families with neurologic conditions during COVID-19, you can check out our CNF COVID-19 Resource Center. It's at www.childneurologyfoundation.org/COVID-19. Together we will get through this, and together we are all child neurology.